the visceral organs, they don't have the greatest innervation to them or map of them in our brain like our body does, like our somatic mapping. This somatosensory map in our brain has mapped our body parts, our body, and there's a very good representation of like our hand, our tongue, our feet, our genitals, our arms, our legs, our trunk, our head, right? Like it's very well mapped in our body, mapped in our brain, and also mapped not just in our big brain, but our little brain, which is our cerebellum. Now, the visceral organs, yes, part of our body, are not mapped quite as well because there's less peripheral nerves to them. And so what happens is because there's less peripheral nerves to the organs than the rest of the musculoskeletal system, the messages that come from the organs sometimes converge with the peripheral nerves innervating the body, the musculoskeletal system, and you get visceral referred pain. So that's called visceral convergence. Visceral convergence, and I'm reading this definition from the interwebs. Viscerosomatic convergence is the neurophysiological mechanism where visceral organ and somatic nerves, nerves to the skin and the muscles, converge on the same spinal cord neuron. Visceral referral is the result, the pain perceived in somatic areas, not the organ itself. So convergence causes the referral because the brain confuses organ pain with skin pain due to shared pathways. Then you have what is called a viscerosomatic reflex. A viscerosomatic reflex is a related concept where visceral inflammation or visceral dysfunction causes chronic localized muscular tension or dysfunction in a corresponding segment of the spine. So, this has to do with the relationship between the sympathetic nerves and the organ areas. So oftentimes, and in the visceral referral cheat sheet, I share all of these. I share with you the visceral referral pain areas, which are going to be more of what is commonly referred to as head zones. Head zones because the doctor who discovered them or first started sharing about them his last name was Head. So these are the pain areas, the referred pain areas, the somatic referred pain areas from the viscera. These ones you already probably are familiar with. This is like when you have a heart attack, you have left shoulder, jaw pain, upper back pain. Spleen also can go to the left shoulder. Gallbladder, shoulders, the mid-back. Pancreas, that mid-back wrapping around pain. Appendix, the hip, low back pain. Kidneys, low back pain. These things are a little bit more mapped and classic referred pain spots. And these are from that visceral convergence. The viscerosomatic reflex is the sympathetic nerves going from that nerve root area to the organ or from the organ back to that nerve root area, causing a reflexive effect at the spine, either within the facet joints, the muscles around the joints of the spine, or the intervertebral joint, all the little nerves that innervate the different ligaments of the spine, etc. The cool thing is you can use this knowledge as a way to differential diagnosis, right? For some reason, when it comes to the athletic training room or the PT clinic, when somebody walks in with left shoulder pain, you don't think heart first thing, because maybe the age of the person, or it's not that severe, or it's been going on for a while, right? Sometimes the thing that makes us think it's a heart attack versus rotator cuff tendonitis is the chronicity of it, or the onset of it, right? But just like a heart attack can instantly create this pain, just dysfunction in the pericardium or within other organs in the area can start to create that pain pattern as well. And so it's funny that we don't think about it. Especially too, the other example I give people is people who have uteruses, especially who menstruate, hello, you have viscerosomatic referred pain on a regular basis. We have, what's called low back pain, but it's really pain on your sacrum or pelvic pain. It's so common. But yet, when someone comes in with back pain, and you ask them to point to it and it's down low like that, oftentimes our first thought is not, oh, it could be your visceral organs of your uterus, your rectum, your bladder, your ovaries, or like your prostate. We think, oh, it's your SI joint. So it's interesting that our brain just doesn't, like, it associates it with visceral sometimes in some settings, but yet clinically it's like it goes, like, disappears.